So sort of the next part of this is, what scans are really necessary to determine, my stage of cancer? Do we need ultrasounds? Do we need MRIs? Do we need CAT scans, bone scans, PET scans? What do we sort of tell patients, in terms of, what scans do we really need to determine whether or not, the cancer has stayed, locally in the area that we think is just the prostate, or has it extended outside of that area? What are your guys' approaches to sort of counseling patients about, what scans are really needed to determine the extent of cancer?
Yeah, so I think if a patient is coming with an isolated increased level of PSA, the typical thought process is not to jump onto the biopsy right off the bat, is to look at how the PSA is behaving over the course of time. That's one way to think about it. And the next biggest thing I feel is that what we have done over the past few years or decade is increase the role of the MRI. So MRI has improved our ways to think about whether this increase in PSA that we are seeing is actually because of cancer or something else. And this can be done with something called as multi-parametric MRI. All the patients need to know is that, MRI can augment our decision making into whether we should actually proceed with a biopsy or not proceed with the biopsy. So before subjecting any patient to an invasive test, we would like to have all the information before, so that we know that the test we are doing is actually going to benefit the patient or not. But yeah, I mean, Dr. Tawazi, I would love to hear your thoughts on it as well.
Yeah, I agree. I think the original steps, when you're working something, a suspicious prostate cancer will be the ultrasound, and usually that's done through urology, and then they may also get an MRI if they need to get more information on the size of the tumor and how far it extends. And then the role of a CT or bone scan, if there are higher risk features like that Gleason that we just mentioned, or if the PSA is high, or if there are findings on the physical exam, for example, that may be suspicious for higher spread of the cancer, then a CT and bone scan can be done. And then increasingly, we're seeing these PET scans replacing the CT and bone scan, which I know we'll talk more about these new PET scans that we're doing, that are replacing what we consider to be the old conventional imaging of the CT scans and the bone scans.
Right, definitely. And I think, what we had discussed before about, the Gleason score, other potential, the PSA level, other risk factors go into making a decision about what the extent of imaging that we're doing up front as well, too. And again, we'll talk a little bit more about that specialized PSMA PET scan in our next discussion. So I think, a part of understanding, prostate cancer is really understanding the stages of prostate cancer as well. And I think this is really important for patients to really know where they sort of stand, because I think our treatment options are very different based on the type of stage, that the prostate cancer is. So typically stage 1 is pretty small, like we showed on that picture in the initial part of the slide, our initial part of the presentation, that is really confined only to the prostate, and is growing fairly slowly. Stage 2 is that it's starting to spread a little bit more. Stage 3 is that it has spread beyond the wall of where the prostate ends, but it has not gotten into the lymph nodes, or the bladder or rectum, or other areas, other organs. Stage 4 is really when we say that it really has gone into the lymph nodes surrounding, places like the bladder or rectum, or even distant organs, such as the liver and bone are sometimes more common with prostate cancer. But it's something that I think it's very important to have your urologist, your radiation oncologist, your medical oncologist explain exactly what stage they think you are, so that way you can have a little bit more informed decision about what the available treatment options are for you after that.
Yeah, and I would just add, I think, prostate cancer is a little bit different than some other cancers where it's more clear cut, like stage 1, 2, 3, 4. I think in general, in terms of how we look at prostate cancer, the stage 1s to 3s can be lumped together, meaning it's only in the prostate, and then stage 4, if it's spread outside of the prostate, are lumped differently. And so those stage 1 to 3s, again, we have like different risk categories, and that's usually how we determine the treatment based on the PSA the size of the tumor, and whether it has spread and what the Gleason score is. So it's a little bit more nuanced sometimes for prostate cancer than other types of cancer in terms of that stage 1, 2, 3, 4.
Agreed. Definitely. I think it's very different than, for example, lung cancer or breast cancer things.